talked about the impact that we will embrace this whole technology.
Yes.
And I'm going to start from left to right and explain how this robotic and IoT, which stands for Internet of Things, sensors actually will be integrated and into our human life. So this blue signal at the top, at the left bottom, is a Wi-Fi signal. So everything has to be
this
connected.
signal,
Exactly.
yes.
So everything has to be connected to the internet. So here, let's imagine two elderly people are sitting there. Now, notice that they would have a smartwatch and they would have an artificial pancreas to keep track of their insulin level, whether it goes up or down, and also the integrated physical chemical smart patch that will keep on the lady, that will keep on showing the glucose level, the blood pressure, and the temperatures as well.
So they are putting on their hands, I can see some pictures there, the wristwatch, or
Right.
putting it there in the arms, and the lady putting like an iPad on her arm.
Right, it's a smart patch
Yes.
that you can even in Kuwait you can buy from different pharmacies.
And on their feet there also, on their
Right.
legs.
On their feet, there are smart shoes that has also IoT sensors,
Okay.
which are very, very tiny, but they keep on transmitting very valuable information to the healthcare providers.
Oh, from the shoes.
From the shoes
Or
itself,
the foot itself. Also.
from the shoe and from the socks as well.
Okay.
Because there are electronic skin that can be built in, and all the purpose of electronic skin is, and we're going to cover that in one of the other sessions, that will produce the communication method. So essentially, it's very, very tiny IoT sensors that actually get either on the
Well,
socks,
it means smart socks.
smart socks,
Smart shoes.
and these the smart watches that we all wear, they produce so much of valuable information from the temperature perspective, blood pressure perspective, even stress level.
Very nice.
So they all of this would be connected to the healthcare providers who are they're monitoring the health of a person in terms of those variables, are they within the threshold that they should be? If not, then imagine if somebody needs to be sent to the clinic for emergency. So, and because they're all connected to the internet, the healthcare service provider would be aware that this patient is coming in. They would already have all the statistics that they need to prepare, what kind of operation that they need.
Continuous data.
Precisely.
And live data being fed to the monitor and screen to the doctor or whoever caretaker of this special patient.
Correct. And if you also notice that the screen where there's on the right side of the man, there is a remote caregiver, which is the telehealth operation where they can actually see the doctor and the patient can see each other, and also discuss, is the person doing something abnormal activity, or what is showing on their analytics, is it really reflective of what they're actually doing? So they can do the pre-consultation ahead of time before they actually get onto the car, or call an ambulance and then go to the emergency room, for example, if they do go there. And onto the left side, the robots are very similar to Pepper Robot, where they can actually walk around, navigate, and interact with
It is serving them like something. It is serving with a plate, giving them some tea, perhaps,
Right.
some coffees.
Right.
It's very interesting. It says here assistive robot, and then there is a robot, pet robot. Is it?
Yes, a robot pet. People love their pets, these robotic pets will not do any. They work on electricity, so they don't need maintenance in terms of cleaning up after them. Now, on the left-hand side, I have mentioned the 10 Ps of the health. So all of these robots are actually available today in various parts of the world. And so all this intelligence from predictive, preventative, personalized, and precision-based mechanism would be built into these robots or these IoT sensors to provide an enhanced and improved lifestyle. So we're not far from it. As a matter of fact, I think if I was to pick a number in terms of statistics, I think we're probably 70-80% already there, what is presented in this picture, in some parts of the world.
The system is connected, this is the IoT.
Right.
This is the beauty of digital transformation, that changing us from the traditional way of readings, taking the measurement, the time that you need to visit the clinic. Now with the digital transformation, everything has been converted to digital, to 1-0. So with the sensors, with these smart devices, with the connectivity of the internet, as you say, it's easy that to be integrated with other devices. Imagine that if the Ministry of Health, they want to issue a study today about how many people in certain area, they have a heart disease.
Exactly.
Or
Right.
there are some sensors that can measure your happiness or your sadness, so they can see how the population, like for example, population of Kuwait, if they are happy or not with
Yeah.
these sensors. These are real
Smart sensors. These are smart sensors.
Yeah, smart sensor.
Which can tell.
And usually these sensors or devices are in every part of the house now. The doorbells, your
The cameras and the
cameras, your mobile,
central heating and
surveillance
cooling
systems.
systems. Yes, the refrigerators also.
So it's important that when we talk about digital transformation, there are various aspects. So there's I only focused on the health side of it, and then the next session I'm going to talk about the education side of it. Of course, it is important that we work within the framework of the Ministry of Health in terms of what is allowed and what is not allowed.
Exactly.
So we need to make sure whatever we do, even in the integration or the development of the IoT sensors, it needs to follow the key parameters. Electronic health records. So imagine a scenario if a person has to go from one hospital to the other hospital. Most of the time, they have to carry a physical paper with them to go, because the electronic health records are not unified.
Yes.
That's an area that, rather than having to duplicate multiple blood tests and whatnot, that's just repeating the same exercise over and over again. Of course, at the end of the day, it costs money as well to the ministry.
Okay.
So they need to be integrated as well, and the information exchanges between among the hospitals and to the patients, those would be something that would be, that are required
Yes.
to.
And it has to be very confidential, by the way,
100%.
and updated also. So this electronic health records will be there, part of the system, isn't it?
Correct, absolutely.
So that whenever the caretakers, whether it is primary or in the hospitals, it will be there, yes.
Absolutely.
Carry on.
And they would be all connected to all this picture that I talked about. So every record is being monitored on the database.
Trends the future's direction. From robots that roam to AI's